Hello again. Now I'm going to perform an NG tube return demonstration. So first and foremost, I'm always going to start with my OE wipes. So first I'm going to verify my order. Next, I'm going to gather my equipment, which would be my patient, NG tube, gloves, pen light, syringe, tape, stethoscope. Then I'm going to wash my hands. Then I'm going to identify myself. My name is Christina Valetic. I'm your student nurse this afternoon. And then I'm going to identify the patient. Can I ask you your first and last name? Can I ask you your date of birth? And identify if the patient has any allergies. Do you have any allergies to medications? Any allergies in general to shellfish? And are you allergic to latex? Then I'm going to do it by privacy, which I'm going to close the curtain or shut my door. Assess the patient's pain, 0 to 10, 0 being the least and 10 being the most. Patient says 0. Then I'm going to put the patient in the correct position, which for this procedure, we're going to want them sitting up in a high Fowler's position. Then I'm going to explain the procedure to the patient, that it may be a little uncomfortable, that I'm going to be sticking a feeding tube down their nose into their stomach. The doctor ordered it. And if there's any kind of pain or uncomfortable during the procedure, to raise their right hand, and we can stop and wait a few minutes and then proceed again. Then I'm going to make sure everything is at a working level, comfortable for me. And I'm going to put my gloves on, and they do not need to be sterile. I can just put regular gloves on. So first I'm going to grab my patient and I'm going to check with my pen light their nasal passageways, their nares, to see if they're clear. Then I'm going to ask the patient which nose, if they could hold their nose and breathe through each side and see which side is clear for them to breathe in. And then I will go with the other nasal passageway for the tube. Then I'm going to also want to get my tape ready, which I have right here, to take my measurement, which would be the NEX, which would be first we'd start to measure by the nose to the ear and down to the xiphoid process. So if I was, say, measuring this patient to the ear and down to their xiphoid process, we would say that it'd be 55. So then I would place my tape at that area, so that way I knew where to stop. And then I would attach my syringe and then what I would do is lubricate the end right here and lean my patient's head back and start to enter their nasal passage. Once I hit some resistance back in the nasopharynx, I'm going to hit some resistance. So then I'm going to ask the patient to put their chin to their chest and swallow. Tell them swallow, 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 until we get to the taped area. Then I'm going to take my piece of tape and I would tape that to their nose, right there. Then I would take the other piece of tape and I would take the other part and attach it to their gown. Now, I'm going to want to make sure my tube is placed in their stomach correctly. So there's actually different ways that you can do that. One of the most accurate ways would be to perform an x-ray. But if you're not capable of doing that, then you would auscultate by listening to their bowels. And you would stick the stethoscope on here, and then you would attach the syringe, and you would push air into there and listen for the whoosh. So I'm listening, and I hear the whoosh of air in their stomach. But you're always going to want to do 2 different ways to make sure the placement's placed right. So the next one I would do is a pH.